We're going to start the briefing, though, with going to Dr. Kasai for his introductory remarks. Dr. Kasai, over to you.
Thank you very much, Adrian. 4 months into the COVID-19 epidemic in the WHO Western Pacific regions, we have more than 164,000 confirmed cases, and around 6,600 people have lost their lives. Countries and areas across our regions are at the different stage of pandemic. Except Hubei province in China in the earlier months of the outbreak, none of the countries in the regions have had a large-scale community transmissions. While we are relieved that, for now, the Western Pacific have averted the worst, we are conscious that the pandemic is far from over, and countries should continue to prepare for the large-scale community transmission by engaging communities and strengthening healthcare capacities. The key to control COVID-19 in these regions has been proactively finding and isolating the cases of COVID-19, tracing and quarantining the contact, and introducing a stringent public health distancing measure, including a movement control, comparatively early in the outbreak. They have averted what would have been devastating consequences in an uncontrolled COVID-19 epidemic. Hospitals have not been overwhelmed, and many deaths have been prevented. But we must also recognize that the socio-economic cost of some of these control measures have been enormous, especially for the most vulnerable. We are facing a profound, complex challenge: how to control the COVID-19 in our communities, while at the same time bringing back our economies and societies. As long as the virus is circulating in this interconnected world, and until we have a safe and effective vaccines available, everyone remains at risk. So we have to find a way to live with this virus for now, and this is what we call the new normal. 3 weeks ago, I mentioned that there's no one-size-fits-all approach to lifting the public health and movement controls measures. The effectiveness of each of these measures and what each society values differs by countries and by cultures. What remains true across different country contexts is that the process shouldn't be rushed. Easing restrictions too quickly would bring on a resurgence of diseases. It needs to be done in the phases based on scientific evidence and the data on the local context. And when restrictions are eased, the key to control the virus is to ensure well-functioning system to detect and isolate cases and trace and quarantine their contacts. It's understandable that everyone's eager to move on. And in the Asia-Pacific region and beyond, WHO is working with the countries on how to ease measures safely in a way that protects public health, prevents new waves of infections, and allows society to regain some degree of normality. We want healthier customers, workers, and then students. We need our offices, restaurants, markets, schools, transportations, and place of worship to be a safe place to work, learn, and connect with our communities. COVID-19 has reminded us of the extent to which everybody depends on health. And each one of us actually can contribute to securing a healthy future and building back our societies and economies. each individual's willingness to maintain healthy practice that protect not only themselves, but their families, friends, colleagues, communities, healthcare workers, and vulnerable around them is the foundation of ability to rebound. We are in this together and can only get out of this together. In moving forward, we should create a new normal in which we don't have to choose between health and livelihood. Rather, we should bring up both. The big decisions on how to do this needs to be made together, bringing the health sector, economic sector, and community together at one table. I believe we can do more than just go back to evaluations of the way we did business and deliver her services before COVID-19. This pandemic has fundamentally changed the world we live in and at a lightning speed. It has also presented us with an unprecedented opportunity to fix the flaws and fractures in our health systems and societies that COVID-19 has exposed. Today, we can work together to shape a new reality, commit to new ways of thinking, living, and working that will make us safer from COVID-19 and other threats in the future. Government are, of course, central to steering us through this. They need to ensure gradual, flexible, and clearly communicated approach to lead us into this future. The private sector can play a critical role in adopting flexible and innovative ways to reopen and conduct businesses while taking necessary steps to reduce the risk of infections in the workplace. It is also about identifying new opportunities to deliver goods and services that are better than those we had before. There are many people's families and businesses facing difficulties under stay-at-home orders and temporary business closures. I know how hard government across the regions are working to fight both the virus and the hardship it has caused to maintain societies. It is not an easy journey, but I think it's time for all of us to do our part and work together to realize our new future, a more caring, stronger, healthier society for everyone. Thank you very much, Adrian.